Introducing the PiezoWave2 Vet from Richard Wolf. The PiezoWave2 Shockwave therapy is very effective at treating and resolving musculoskeletal injuries. The majority of PiezoWave2 therapy sessions begin with slowly moving the therapy source across the general area of the suspected injury at a low-intensity setting between 1 and 3 on the control unit. This establishes where the treatment needs to be applied by flaring the injury. Once established, the position of the therapy source is maintained on the area that is being flared, and intensity is adjusted based on patient cues. The PiezoWave2 uses focused sound compression to effectively target and treat injuries at various depths of penetration, including disorganized or delayed healing of fractures, tendinitis, osteoarthritis, elbow and hip dysplasias, sesamoiditis, and chronic back pain.
And then I started to research more about shockwave, the difference between focused shockwave and radial shockwave, high intensity, low intensity. It was all new to me because we had heard about it at Canine Rehab Institute in our training, but I had kind of dismissed it as a modality that I probably wouldn't get, that I would probably get ultrasound, but not shockwave, because I had kind of been told that it was very painful for the patient, B, that it was very loud, and those two factors meant that you had to sedate the patient in order to do the treatment. What I've learned since then is that it doesn't have to be that kind of session. It can be low intensity, it's not loud, it's not painful, it can be an outpatient procedure, and it is with my patients, and I get tremendous results. It would be easier to tell you which cases I don't use it in when it's contraindicated as opposed to how to use it, because I use it in almost all of my patients. So breaking up tissue, blocking pain, and then lastly, another big biological effect when you look at the literature is stimulating regeneration of tissue. It jumpstarts the growth factors coming in to build more fibroblasts, collagen stimulation, chondrocyte and osteogenesis, so bone remodeling, cartilage repair, fibroblast production. And I'm treating the area that primarily she has had myofascial pain in the past. Today, normally I checked her before the start of this webinar. I would palpate for muscle fasciculation, and I look for that fasciculation and I start treating in that region.
Well, we researched our Shockwave machine before we made this purchase, and I've used Shockwave on equine many times. And one of the big differences between this machine and the others is patient comfort, both with sound, and we always think about how much more sensitive our patients' ears are than ours. But a lot of the other machines, when you dial up, they start at 5 or 6 kilovolts. You can tell from videos the different sounds. So the higher the kilovolt, the higher the sound wave. As we're doing this, a 0.1, a 0.4, dogs don't react to. And so we're able to give them the treatment that they need. And because we're slowly going up to their pain threshold, to what they can tolerate, they're not jarred by a sudden sound of a 5 or a 6 kilovolt. By the time we've worked up to it, they've been desensitized. Pain-wise, again, same thing. Starting off with a machine that starts at a 5 or 6 kilovolts is painful. It's like a beating to the patient. Because we're a standalone clinic, and because we're dealing with geriatric patients, anesthesia and sedation are not an option for us. We have 15 and 16-year-old dogs that come in here, and so sedating them once a week, one, would add to the cost for the patient, but also would add to the demise. And so we wanted a machine that we would not have to add morbidity to the treatment. We just wanted to see the positive effects. With our Shockwave being able to dial it up, they are able to get comfortable with the machine, they're comfortable with the treatment, and again, no bruising, no swelling. Even in our dogs, our lowest platelet count dog was 70,000, and no bruising with that. And that's pretty amazing to have that modality. Well, it's wonderful. It acts like another technician. With it taking a minute and a half or less to treat a patient, it allows us to diagnose down to the exact area that the patient hurts, immediately provide comfort for the patient, immediately help them in their healing, and not add to the cost of running a business. This machine, from the moment you turn it on to the moment you turn it off, it's the same fixed number as far as cost. We're not having to replace sound heads every so often like you do with other machines. And again, we're not having to take away time of sedating, placing IV catheters, running blood work. We're able just to get a patient in and out in 2 minutes time. So really adding to the cost benefit for ownership. Being veterinarians, we like to know that we're getting our money's worth. And anytime we're buying an expensive piece of equipment, we want to know it's going to be utilized. I really thought, as we were doing just kind of pen to paper, that if we utilize this machine 3 times a week, not only would it pay for itself, but it would add to the revenue that we were bringing into the practice. I was overwhelmed in the first 2 weeks of ownership that we were using it on average 10 to 15 times a day. And if you think about, even though we're not doing the sedation, we're not doing the IV catheter, we're not doing the blood work, all the things necessary for sedation, we really thought that would drastically hurt us with the price and the breakdown. And what it's done is it has added to the business without taking away from patients. So it's allowed us to treat more patients, to see more patients, to help more patients, and has cost us less and less with each week of owning it.